So last year was a strong year for Syncona. We started the year by closing the sale of our portfolio companies Blue Earth and Nightstar. Those sales brought in just under £600 million of cash proceeds at a 6.6 times a multiple of invested capital, so a good result for shareholders. As a result of these divestments, we closed the financial year with the capital pool standing at £767 million. And as we've spoken to you over the years, we've maintained the view that a strong capital pool is absolutely central to the delivery of our strategy. And hence the decisions that we've taken over the last 12-24 months, particularly with reference to the divestment of Blue Earth and Nightstar, have really put us, I think, in an exceptionally strong position. And the events of the last few months with the COVID crisis, I think, have shown that view around maintaining a strong capital pool has never been more true. And really, as a consequence of where the capital pool stands today, the business is on a very strong footing and well positioned to continue to grow and support our companies over the years to come. We invested £206 million during the year to continue growing the portfolio, including the addition of an investment, a £29.5 million commitment to a new company, Aziria. And the portfolio today stands at 9 companies. And so we continue on our stated strategy of growing to a sustainable size of 15 to 20 companies. The team is in good shape, and we've added some very strong people to that team during the year. We're really delighted that Danny Bar-Zohar has joined from Novartis, where he was the head of global clinical affairs, and Lorenz Meyer has joined from GE Healthcare, where he was the chief technical officer. And these people are making a significant impact to the team already and increasing the capability of our existing bench. NAV closed the year at £1.2 billion, which was down 13%, which is obviously a disappointing result. There were a variety of movements there. The largest effect was a fall in the Autolus share price. I'll come back to Autolus in a minute, which offset gains elsewhere from, for example, a markup in Achilles, where we closed a very successful Series B financing the company at a sort of significant uplift, and also there were some uplifts from the divestments that we closed during the year as well. Coming then to Autolus, there will always be volatility in our early stage companies. We understand that. Our strategy is very much around seeking to identify companies that we think can build products and develop products all the way to regulatory approval and ideally into the market. And Autolus is very consistent with that strategy, and we believe has made strong progress towards that strategy. Call out progress on the Auto1 program for the treatment of relapsed refractory adult ALL, a form of adult leukemia. That program will now move into a pivotal study during this financial year. And at the recent American Society of Clinical Oncology meeting held just a few weeks ago, Autolus put out strong data in their Auto3 program for the treatment of diffuse large B-cell lymphoma. So we remain strong supporters of Autolus, and encouragingly, since the year-end results, actually the share price has doubled since that point. Elsewhere in the portfolio, we've seen a further strong clinical progress, calling out, for example, Freeline, who produced data in their haemophilia B program, and very encouraging data showing the potency of their platform, and also dosed their first patient in their second program, the Fabry's program. Achilles, a cell therapy company working in the oncology space, we're very excited about that company. Dosed their first patient just after year end, their melanoma patient, and have made very strong progress towards launching their second clinical study in non-small cell lung cancer, and we would expect to see that study also move into the clinic during this financial year. Lastly, to Gyroscope, of the clinical stage companies, Gyroscope completed the phase 1/2 dose escalation study. There were no safety signals from that, and they've indicated they will move into a phase 2 study, but we'd expect to see some data from that study during the upcoming financial year. Among the non-clinical stage companies, we'd just like to call out Avion and Quell. Avion is a company operating in the next generation IL-2 agonist space. These are products to stimulate the immune system for cancer, and they nominated a clinical candidate and will look to move that into the clinic. And Quell, which is a company that we founded in the cell therapy company in the T regulatory space, also has moved to nominate a clinical candidate and will move that forward in liver transplantation. So good progress across the portfolio. In summary then, I think we've had a very good year this year. We've continued to build the companies consistent with strategy, and we're beginning to deliver the clinical data that we think can drive the value forward in these companies. The team is in good shape. They've worked well together through the COVID crisis, and we're delighted to have added some strong new members to that team. We closed the year with 9 companies in the portfolio, and I think well positioned to continue to grow value for shareholders.